Product development company Sisu typically works on things like a cinema robot or a knife sharpening robot. But as some hospitals were overwhelmed by COVID-19 in mid-March, Sisu got a call to change gears.
And he asked if Sisu could make a ventilator in 2 weeks. And I said, absolutely we can. What's a ventilator?
A new Austin nonprofit called Airboost wanted to put money toward making a more affordable device.
We basically donated insurance money to society to make sure that there'd be ventilators that could be produced and we wouldn't have to watch people go without.
Sisu's team of 40 employees worked to develop a prototype based on a project started out of MIT.
From there, we really expanded on more features in working with doctors, closely with them to get feedback.
Within 3 weeks, we had a unit to test, and we were actually in discussion with Mount Sinai Hospital. We had sent them out prototypes to look at.
And Sisu says Baylor Scott and White Health offered feedback on the design too. These ventilators can be assembled entirely by hand.
This is an example of some of the mill work we have to do.
And many of the parts are made in-house.
We have Model 1 and Model 2, and then this one is Model 3.
The result is a machine designed to push needed air into the lungs of COVID-19 patients.
I hope that these ventilators can bring down the cost of treatment for people who are experiencing respiratory issues.
While some ventilators can cost tens of thousands of dollars, Airboost says theirs will range between $1,000 and $2,000. They're waiting for approval from the FDA for an emergency use authorization. Once that happens, they've already been requested to make 1,000 ventilators for Texas hospitals.
Local hospitals and some local state governments that are very interested in this device. We've also been talking with the military.
It's a feat of engineering and a piece of the Austin area that may soon be on the front lines of the pandemic. Alyssa Goard, KXAN News.